If you're over 60, here's what almost nobody tells you. Some healthy vitamins can quietly raise your stroke risk, especially overnight. No pain, no warning. You go to bed fine. You wake up slurring words. National surveys show more than half of Americans 60 plus take supplements daily. Yet dose and timing matter. At night, blood pressure and vessel tone shift. Excess vitamin D can spike calcium. High-dose E can thin blood too much. Mega C can feed kidney stones. The wrong pill, at the wrong dose or time, can light the fuse while you sleep. Could a natural pill be nudging your blood chemistry the wrong way? Drop a 1. In the comments if you've wondered. If this is new, and hit subscribe so you don't miss what may literally protect your brain. I'm Dr. Mark Hyman, MD, a physician for 30 plus years and a leader in functional medicine. I've helped thousands of patients find root causes behind fatigue, brain fog, and high blood pressure. In this series, I'll walk you through 9 vitamins that can backfire D, E, B6, A, B3K, folic acid, C, magnesium, and what to do instead, so you can stay sharp, strong, and independent. Walter was 74, a retired Navy machinist from Wilmington, North Carolina. After a dermatology scare, he avoided the sun and made up for it with a 10,000 IU vitamin D3 soft gel. Every night, no labs, no questions. For 11 months, he felt terrific. Then, one Sunday morning, his wife found him on the couch with a crooked smile and slurred speech. In the ER, the scan confirmed a small ischemic stroke. His blood work told the rest of the story: calcium elevated, vitamin D sky high. His parathyroid hormone was suppressed. A classic clue: the dose had overshot the mark. Here's the biology in plain English. Vitamin D is fat-soluble and accumulates. It boosts calcium absorption from the gut. When you chronically exceed your needs, especially above 4,000 IU per day, calcium doesn't just strengthen bone. It spills into the bloodstream, where the body can deposit it in arteries and kidneys, calcified. Stiff vessels plus an overnight blood pressure surge is a dangerous setup for the brain. Late evening dosing adds fuel to that fire, because calcium regulation is lowest as you sleep. Common pitfalls I see in clinic: oversized OTC capsules, 5,000 to 10,000 IU. Stacking D with high-dose calcium. And set and forget dosing without lab checks. You wouldn't double your blood pressure pill without numbers. Don't do it with vitamins either. What I had Walter do: we stopped the megadose immediately, hydrated aggressively, and let his calcium normalize. We reintroduced vitamin D only after labs, targeting a 25 hydroxyvitamin D level, around 30-50 nml, not a random pill. He now takes a modest dose in the morning with food, walks after breakfast, and gets D from salmon, eggs, and short, safe sun. 3 months later, his energy returned. His follow-up imaging still showed vascular calcification, but no progression. If you're over 60, here's the rule of thumb. Don't supplement just because. Test first. Aim for the smallest dose that gets you into range often, 600 to 800 IU per day total from food and supplements. unless your clinician prescribes more. Take it in the morning. Avoid megadoses. And be cautious if you also use thiazide diuretics or calcium pills. Sunshine is essential to life, but in a bottle. Too much sun can burn you from the inside out. If vitamin D can quietly harden arteries, vitamin E can tip the opposite balance bleeding. Evelyn, a 68-year-old retired librarian from Columbus, Ohio, took an 800 IU vitamin E capsule every night for circulation, on top of her prescribed warfarin for atrial fibrillation. For years, her INR was steady. Then she added that high-dose E after a friend's recommendation and didn't tell her cardiologist. 2 months later, a thunderclap headache woke her before dawn. She grew nauseated, her speech slurred, and her daughter drove her to the ER. A CT scan showed a small intracerebral hemorrhage. Labs told the rest her INR had jumped out of range despite no change in warfarin. The only new variable was the nightly vitamin E. Here's the biology in plain English. Vitamin E is fat-soluble and accumulates in tissues. At higher intakes, especially 400 IU day, it impairs platelet aggregation and can antagonize vitamin K-dependent clotting factors. On its own, that might just mean easier bruising. Combined with anticoagulants, warfarin, or daily antiplatelets, aspirin, clopidogrel, it can push the system too far, particularly in the brain's fragile microvessels. The evidence is not subtle. A 2011 Journal of the American Medical Association meta-analysis found vitamin E supplementation increased hemorrhagic stroke risk by about 22%, even as it slightly lowered ischemic events. Translation for real life: if you're already thinning your blood with medication, adding high-dose E is playing tug-of-war with your own clotting system at night while you sleep. What we changed for Evelyn was simple and strict: stop supplemental E immediately. Keep warfarin, but recheck and retarget INR. Switch to food sources of vitamin E: sunflower seeds, almonds, spinach, avocado, where doses are moderate and packaged with other nutrients. We also added a label check rule if you see 200, 400, or 1,000 IU on the bottle. That's a red flag to call your doctor first. For most older adults, the RDA, about 15 millimoles 22 IU, is plenty when your diet is decent. One more safeguard: always disclose every supplement natural or not at each medication review. Anticoagulation is a balancing act. Surprise variables cause falls. Evelyn recovered with rehab and tighter INR monitoring. And next time she reaches for a heart-healthy capsule, she reaches for her phone first. If vitamin E can push you toward bleeding, vitamin B6 can quietly do something just as frightening: switch off the messages your nerves send to your brain. Frank, 72, from Dayton, Ohio, wanted sharper focus and steadier energy. He bought a glossy NeuroSupport B complex at a warehouse club, 100 milligrams of B6 per capsule, and took 2 a day for a year because the label promised brain and nerve defense. The first warning was small, a buzz in his toes at night. Then came burning in the feet, numb fingertips, and clumsy missteps on curbs he used to clear without thinking. In my exam room, his heel-to-toe walk wobbled. Nerve conduction studies showed markedly reduced sensory nerve action potentials, classic peripheral neuropathy. Labs sealed it plasma B6 PLP far above the reference range. He didn't have diabetes, didn't drink, and his B12 and thyroid were normal. The outlier was B6. Here's the biology in plain English. Pyridoxine vitamin B6 is water-soluble, but at high chronic doses, it accumulates in the dorsal root ganglia, the relay stations that carry touch and pain to your spinal cord. Too much B6 becomes neurotoxic, injuring the myelin and the axons underneath. Signals fade, then fail. A 2017 review in Clinical Neurophysiology linked months of intakes, 100-200 mg a day, with sensory neuropathy, sometimes only partly reversible even after stopping the supplement. In the U.S., the upper intake level is 100 mg a day. Yet many nerve, brain, and energy formulas hide 50,000 to 250 milligallons per serving, and people stack them without noticing. What we changed for Frank, we stopped B6 immediately, purged every product that listed pyridoxine high on the panel, verified B12 was adequate, and started balanced strength therapy. For nutrition, we aimed for food-level B6 style chicken, salmon, potatoes, chickpeas, bananas measured in milligrams. Not hundreds of milligrams. The RDA for men 51 plus is 1.7 milligal a day. At 3 months, the burning eased. At 6 months, his gait was steadier, though he still uses a cane at night. Nerves heal slowly, sometimes not completely. Your checklist read labels. Add up milligrams across every bottle. Be wary of any single product listing 50 B6, and never treat neuropathy with a supplement that can cause neuropathy. If a doctor prescribes higher B6 for a specific reason, for example, with isoniazid, it should be time-limited and monitored. If B6 can sabotage nerves, the next pitfall hits the brain from another angle, preformed vitamin A that silently raises pressure inside your skull. If B6 can sabotage your nerves, the next trap hits your brain from a different angle, preformed vitamin A. In my clinic, I saw a 79-year-old retired piano teacher in Portland, Oregon, who wanted sharper vision and ageless skin. For 5 years, she'd taken a Beauty and Eye Stack, a daily multivitamin, plus a separate 10,000 IU vitamin A soft gel every night. Sundays, she'd treat herself to beef liver. No labs, no guidance. Just good intentions. The symptoms crept in. First, pressure headaches behind the eyes. Then the sheet music blurred, dizziness on the stairs, and a morning when her daughter noticed she was slurring words on the phone. In the ER, her brain scan showed no clot, but a lumbar puncture found a markedly elevated opening pressure, classic intracranial hypertension. Ophthalmology documented early papilledema, liver enzymes mildly high. The problem wasn't a tumor. It was the bottle on her nightstand. Here's the biology, plain and simple. Vitamin A in retinol form is fat-soluble and accumulates in the liver. With age, we clear it more slowly. Excess retinol can raise cerebrospinal fluid pressure, pseudotumor cerebri, pounding headaches, transient visual blackouts, double vision, and if missed, permanent optic nerve damage. Long-term high retinol also suppresses osteoblasts and stimulates osteoclasts, thinning bone and raising hip fracture risk. Classic reports in the New England Journal of Medicine, plus cohort data in older adults. Link chronic intakes near 10,000 IU day with headaches, hair loss, elevated liver enzymes, and bone demineralization. What I changed was immediate and simple. Stop all preformed vitamin A. Limit organ meats. Switch to beta-carotene-rich foods, carrots, sweet potatoes, spinach, where the body throttles conversion safely. We added morning-only vitamin D, lab-guided, weight-bearing exercise, and calcium from food, not pills. 8 weeks later, her headaches faded and vision steadied. Her DEXA still showed some bone loss, but on follow-up, no further decline. She went back to teaching scales to second graders, a little wiser about labels. Your checklist. If you're over 60, scan bottles for retinol, palmitate, acetate, and totals over 3,000 IU. That's a red flag unless a physician documents deficiency. Remember that multivitamins, skin formulas, and cod liver oil stack. If you develop new headaches, blurred or double vision, or ringing in the ears, stop the supplement and call your doctor. With vitamin A, the danger isn't one big gulp. It's the slow, silent buildup you don't feel until you do. If vitamin A can build up quietly, niacin vitamin B3 can backfire loudly on your liver, your sugar control, and your blood pressure. Walter? Yes. The same disciplined Navy machinist from North Carolina wanted a natural way to raise HDL and dodge statins. After reading forum posts, he ramped up to 2,000 milligrams of niacin nightly, flush-free on weekdays and extended release on weekends so he could sleep through the heat and tingles. At first, the classic prostaglandin-mediated flush felt like proof it was working. Then came night sweats, dizziness on standing, and creeping fatigue. At his checkup, liver enzymes ALT, AST were 3x normal. Fasting glucose had edged into prediabetes, and uric acid was high. He'd had a toe flare he swore wasn't gout. An ultrasound showed fatty infiltration of the liver. He had no alcohol history, no viral hepatitis, no new meds. The outlier was megadose niacin. Here's the biology in plain English. Therapeutic niacin lowers LDL and raises HDL by inhibiting VLDL production in the liver via DGAT pathways. But at gram-level doses, it can stress hepatocytes, worsen insulin resistance, raise uric acid gout flares, and cause orthostatic drops in blood pressure. The big trial, HPS-2 Thrive, New England Journal of Medicine, 2014, tested niacin, added to statins, in over 25,000 patients. No extra heart protection, but more serious side effects, liver problems, infections, bleeding, and glucose issues. Translation: in the modern statin era, high-dose niacin rarely adds benefit, but clearly adds risk, especially for older adults. What we changed for Walter was tight and test-driven. We stopped niacin immediately, both flush-free, inositol hexanocotinate, ineffective for lipids, and extended release, which is most hepatotoxic. We restarted a low-dose statin, added 2 to 4 g/day EPA, DHA from fish or capsules, upped soluble fiber oats, beans, psyllium, and set a 12-week lab cadence LFTs, A1C, lipids, uric acid. 3 months later, ALT/AST normalized. HDL was fine without niacin, and the gouty toe stayed quiet. He still chuckles at the idea that flushing meant success. Turns out, it was my liver waving a red flag. Your checklist: if you're over 60, don't self-prescribe. 4,000 Sabogourks day niacin. If ever used, it must be physician-directed with labs every 8 to 12 weeks. Avoid extended release for DIY use. Flush-free forms don't improve cholesterol anyway. If you're on a statin and eating smart, added niacin seldom helps. Ask for data, not anecdotes. If niacin's danger is overriding your liver, the next trap is undermining your blood thinner. Vitamin K can quietly neutralize warfarin and tilt you toward a clot. If niacin's danger is overriding your liver, vitamin K's trap is subtler. It can quietly neutralize your blood thinner and tilt you toward a clot. In clinic, I saw an 84-year-old retired music teacher in Burlington, Vermont, on warfarin for atrial fibrillation. For years, her INR sat perfectly in range. Then, she got healthy, switched to a new multivitamin for women 80 plus with 120 mcg of vitamin K1 and doubled down on kale and spinach after reading about superfoods. 2 weeks later, she had 30 minutes of slurred speech and a heavy arm, a transient ischemic attack. Her INR, once steady, had dropped well below target. Here's the biology in plain English. Vitamin K, especially K1 or phylloquinone, is the cofactor that lets your liver gamma carboxylate clotting factors 2, 7, 8, and X, turning them on. Warfarin works by blocking the vitamin K epoxide reductase, VKORC1, that recycles K, which is why your dose is titrated to INR. When you abruptly increase vitamin K intake from a multivitamin, a greens powder, or big swings in leafy vegetables, you supply more cofactor. Your clotting factors activate more efficiently, and your INR falls. Result: thicker blood, higher clot risk, and in the brain, a stroke that can steal speech, memory, or independence. Both K1 from greens and K2, forms found in some supplements, can affect INR. The issue isn't which form, it's the sudden change. What we changed was consistency, not avoidance. We kept her leafy greens, but fixed the amount 1 cup cooked spinach at lunch every day and removed the new multivitamin. Her anticoagulation clinic adjusted warfarin to the new baseline and rechecked INR twice over the next week. No more episodes. I reminded her that meal replacement shakes, fortified soups, and superfood powders often hide 50 to 200 mcg of vitamin K per serving. Labels say phylloquinone, vitamin K1, or menaquinone 7. Your checklist: if you're on warfarin 1, do not chase or avoid vitamin K. Keep it steady. The RDA is about 90 mcg per day for women, 120 mcg per day for men. Hitting a similar amount daily helps your dose stay accurate, too. Call your clinician before you start or stop a multivitamin. Greens powder or diet change. Ask to recheck INR within 3 to 7 days. 3. Tell every provider about every supplement. Natural still counts. If you and your doctor ever decide to change off warfarin, make that decision deliberately. Until then, Consistency is your best protection. If vitamin K's risk is inconsistency, the next pitfall hides in plain sight. Folic acid B9 can mask a brain-damaging B12 deficiency until it's too late. If vitamin K's risk is inconsistency, folic acid's danger is misdirection. It can mask a brain-damaging B12 deficiency until it's late. A 77-year-old former court stenographer from Pennsylvania came to me with slips in memory, word-finding pauses, and a wobbly gait. Fearing dementia, she doubled down on a memory supplement 800 mcg folic acid per tablet, 2 per day. She also took metformin for diabetes and a PPI for reflux. Both reduce B12 absorption. Her primary doctor had checked a basic CBC normal. That's the trap. Folic acid can normalize the blood picture, no big red cells. Normal hemoglobin, while B12-related nerve damage marches on. On exam, she had reduced vibration sense in her feet and a positive Romberg. Labs told the real story. Low normal serum B12, elevated methylmalonic acid, MMA, and homocysteine, biochemical proof of functional B12 deficiency despite okay blood counts. Here's the biology in plain English. Folate B9 and B12 work together in one carbon metabolism to build DNA and maintain myelin. When folic acid is high, the bone marrow keeps making red cells, so the warning light anemia never turns on. Meanwhile, without enough B12, myelin breaks down, causing numbness, imbalance, cognitive fog, even permanent neuropathy. Older adults are at special risk: atrophic gastritis, intrinsic factor loss, pernicious anemia, and drugs like metformin and PPIs blunt absorption. Large U.S. cohorts show that high folate plus low B12 correlates with worse cognition and neuropathy in seniors. The RDA's 400 mcg DFE for folate, 2.4 mcg for B12. The UL for folic acid synthetic is 1,000 mcg per day because of this masking effect. What we changed was targeted and fast-stop high-dose folic acid. Start B12 repletion 1,000 mcg cyanocobalamin daily by mouth or weekly IM. Then taper and recheck B12 MMA. Homocysteine at 8-12 weeks. We kept folate from food beans, leafy greens, citrus, and let the supplement rest until B12 normalized. 3 months later, her balance improved and word-finding eased, though subtle numbness in the toes remained. With nerves, time is tissue. Your checklist: if you're over 60, don't treat memory with folic acid unless your clinician has checked B12 plus MMA plus homocysteine. If you take metformin or a PPI, ask to screen B12 yearly. Keep folate mostly from food. If you supplement, stay 400 to 800 mcg per day and never exceed 1,000 mcg without medical supervision. Classic symptoms of B12: trouble numb toes, imbalance, tongue soreness, fatigue, memory slips. Treat the cause: B12, not the lab printout. If folic acid can hide a deficiency, the next harmless vitamin can build kidney stones you can feel. Up next, vitamin C. If folic acid can hide a problem, vitamin C can carve one you'll never forget: kidney stones. A 71-year-old patient in Texas swore by his Immune Fizz 1,000 packets every morning and kept a bottle of 1,000 million chewables in the truck just in case. 10 months in, a knife-like pain hit his right flank at 4 a.m., followed by burning urine and nausea. In the ER, CT imaging showed 2 calcium oxalate stones 3/4 mm inching down his ureter. Here's the biology in plain English. Vitamin C ascorbic acid is water-soluble, but high doses convert to oxalate, which the kidneys must excrete. When intake creeps 1,000, 2,000 mg a day, urinary oxalate climbs, crystals form, bind calcium, and set like gravel along the urinary tract. Dehydration. Common overnight concentrates those crystals, which is why attacks often wake people before dawn. Add a high oxalate diet spinach, almonds, beets, and you've mixed concrete. A 2013 JAMA internal medicine cohort found men taking 1,000 mg day supplemental C had 2x the kidney stone risk versus non-users. Women are less studied, but case series show the same chemistry. His labs were classic microscopic hematuria, oxalate crystals on urinalysis. We stopped the megadose C, pushed fluids, and added citrate lemon/lime to inhibit crystal formation. Urology cleared the stones with conservative therapy. He left with a new rule: no more immune dumps. A few more truths. The RDA is 90 mg a day for men, 75 mg a day for women. Most Americans get that from food. The tolerable upper limit UL is 2,000 mg a day, and it's a ceiling, not a target. Mega C doesn't prevent colds. At best, it can shave a day off symptoms for some people, while raising stone risk, especially in older men. Vitamin C also boosts iron absorption. If your ferritin runs high, or you have hemochromatosis, think twice before piling on gram doses. Your checklist: if you're over 60, prefer food sources: bell peppers, strawberries, broccoli, citrus. If you supplement, keep it with 500 mg a day, take with a meal, and never at bedtime. Drink 6480 I's water day more in heat. Add a squeeze of lemon for citrate. History of stones or chronic kidney disease. Talk to your doctor first and get a 24-hour urine stone panel before using C regularly. If vitamin C can etch stones you can feel, the next relaxing mineral can drop your pressure so fast you hit the floor. Up next, magnesium. If vitamin C can etch stones you can feel, magnesium can drop your blood pressure so fast you won't remember the fall. An 85-year-old Korean War veteran in Indiana lived alone, proud and independent. He took lisinopril for blood pressure and a small evening diuretic so I don't swell. After a week of stubborn calf cramps, he added a sleep and muscle magnesium citrate powder at bedtime, about 500 mg elemental magnesium total, because one scoop didn't do much. So I used 1.5. At 5:20 a.m., he stood up from the toilet and the lights went out. His neighbor found him on the bathroom floor with a purple bruise above his eye. In the ER, his CT was clean, no stroke, no bleed, but his blood pressure was 85/50 with a big orthostatic drop when he tried to sit up. Labs were normal. Troponin negative. The magnesium wasn't contaminated. The timing and dose were the problem. Here's the biology in plain English. Magnesium relaxes smooth muscle and acts a bit like a gentle calcium channel blocker. That's why it eases cramps. At high doses, especially citrate or oxide, it also pulls water into the gut laxative effect, which can dehydrate you overnight. Add a bedtime diuretic or BP pill, and you've stacked vasodilation, volume loss, and the body's natural nighttime pressure dip. Stand up quickly at dawn and blood rushes down. Nod up syncope. For older adults, one fall can mean a hip fracture or a brain bleed you don't walk back from. What we changed, we stopped the bedtime powder, treated his scalp cut, and rehydrated. His primary rewrote the plan, split magnesium into 100, 200 milligrams with meals morning, afternoon. Switched him to magnesium glycinate, gentler on the gut, and held the evening diuretic. We reviewed drug-nutrient interactions. Magnesium can potentiate BP meds, and it binds antibiotics, tetracyclines, quinolones, separate by 2 to 4 hours. We also set targets. RDA is 420 milligrams day for men, 51 plus, 320 milligrams day for women, counting food first: beans, nuts, leafy greens, whole grains. A few rules to keep you upright. If you're on any blood pressure med or diuretic, avoid high-dose magnesium at bedtime. Start low, go slow. Split doses. Aim for food plus small supplements, not powders the size of a scoop. Hydrate. A simple 8 to 10 cups of water across the day prevents the overnight dip plus dehydration combo. New dizziness when standing, blurred vision, or near faint after starting magnesium. Stop and call your doctor. Relief shouldn't knock you down. We use magnesium in medicine because it works, but like every tool, dose and timing make it therapy or a trip to the ER. Across these 10 parts, we mapped quiet risks hiding in familiar bottles. Not fear clarity. Vitamin D, when overdosed, hardens arteries and kidneys. Vitamin E, stacked with aspirin or warfarin, nudges you toward bleeds. Vitamin B6, in triple-digit milligrams, burns peripheral nerves. Preformed vitamin A raises intracranial pressure and thins bone. Niacin strains the liver. Glucose and uric acid without improving outcomes. Vitamin K, taken inconsistently, neutralizes warfarin. Folic acid can mask a B12 deficiency and mislead your labs. Vitamin C feeds oxalate stones at gram doses. Magnesium at bedtime can drop your pressure and trigger a fall. None of this says never. It says no. Right nutrient, right patient, right dose, right time, for the right reason with follow-up. That's how you stay sharp. Steady. I'm not anti-supplement. I'm pro-precision. Food first, then labs, then targeted doses with timing that fits your biology. Mornings beat midnights. Consistency beats extremes. And natural still deserves the same respect you give a prescription. If you're over 60, here's your next step today. Lay every bottle on the kitchen table. Circle units and doses. Ask, do I need this and is the dose safe? Does the timing make sense? Then partner with your clinician. Check 25 OAH vitamin D, B12, with MMA and homocysteine, lipids, uric acid, kidney function, and INR. If you use warfarin, bring your bottles to your next visit. Build a routine around meals, water, sleep, walking. People who make you laugh. Do it with intention. Walter, Evelyn, and Frank didn't mean to gamble with their health. The difference between harm and help is a decision made before bedtime. One label, one dose, one call to your doctor. If this helped, drop a one, share it with someone you love, and subscribe for more truth you can use. Add life to your years and years to your life.